when we look at leaky gut, what is that? There's a breakdown or loss of that integrity of the mucin layer, perhaps inflammation with the enterocytes and the lamina propria with inflammation down there. Because you have a lot of immune cells, mast cells, macrophages, so forth in that lamina propria. And so if you have imbalance in your microbiome, in other words, inflammatory bacteria that are not in the desirable, shall we say, ratio, then those bugs are highly inflammatory.
Welcome to Becoming Virtuosa, the podcast that encourages you to become your best virtuosa self. Each week, Dr. Susan Crockett goes where the scalpel can't reach, exploring conversations about how to be, heal, love, give, grow, pray, and attune. For the first time ever, she's bringing the personal one-on-one teaching that she shares with individual patients to you on this broader platform. A weekly source of inspiration and encouragement designed to empower you. By evolving ourselves as individuals, we influence and transform the world around us. Please help me welcome board-certified OB-GYN specializing in minimally invasive GYN surgery, internationally in the top 1% of all GYN robotic surgeons, a certified life coach, and U.S. News top doctor, your host, Susan A. Crockett, MD. Hey, y'all. Welcome back to the Dr. Crockett Show. Happy Tuesday. I am back with my very good friend and former guest, come back again by popular demand, Dr. David Reed Miloy.
Honored to be here. Thank you.
Welcome back.
For having me.
You're welcome. Mm-hmm. It's a special treat because right now around here, we're starting to call you the professor. I just love how we interact because he brings all the detail and the lecturing, and then I kind of chime in. We bring it to you and make it relevant to you and have a really good talk. So we're going to do something a little bit different today. We've got a show that we're going to talk about. The microbiome is the big hot topic in our circles. So Dr. Miloy is a fellow physician. For those of you that don't know us, I'm a OB-GYN, a minimally invasive or robotic surgeon in San Antonio, Texas. Dr. Miloy is an internist in Kerrville, Texas, and he owns his own practice. And another fun fact, we're both life coaches.
Yep, we both do wellness and life coaching, and we're colleagues. We're like-minded, right? Yeah. Part of the tribe, people trying to get the general public healthier by going to the source of what causes pain, and then also the source for what causes happiness.
So we're going to get into that really extensively today. So I know y'all are used to seeing this show be about 20 to 30 minutes long, and we may decide to chop this down into segments. But I want to try something different because, I'm always encouraging y'all to try something different, try something new. We're going to try to go long format, Rich Roll, Lewis Howes, Andrew Huberman, all those guys where they just go for an hour and a half or so and talk about everything.
We'll see where it takes us.
Yeah. So we're going to start with a conversation about microbiome and wander into some other things, but all of it is aimed at helping give you guys information about becoming more healthy in your environment, about helping you transform, because we believe when we help the individual transform, that helps our world transform.
Yes, absolutely. The best version of ourselves shows up, the world gets better.
That's right. So, my practice is Virtuosa GYN, and that means the feminine best version of yourself.
Absolutely.
Virtuosa. So thanks for that little, you didn't even know you were feeding me that. Thank you.
Or I'm sneaky.
That could be too. All right. So, hot topic. Gut microbiome. This is all over everywhere I look. It's on every podcast. It's on every television show. It's all kinds of bestsellers coming out. Everybody is talking about gut microbiome. And so I brought an expert today. Dr. Miloy knows more about this than anybody I know. And so I wanted to just give you a chance to start talking about what it is, break it down into what our patients can understand.
Yeah, sure. So we're not going to get into too much technical stuff, but we'll kind of touch that a little bit. But basically, the microbiome is not just what's in our gut, but what's in our bodies, or on our bodies. We have bacteria, bugs that live on our skin, in our sinuses, in our mouth. And when we talk about in vagina for women, so when you talk about microbiome, any place there's an opening in the body, there's going to be microbes. And gut microbiome, we're talking about mouth to anus. That's the whole,
tract,
that's just
all the way through.
It's a tube.
It's a hollow tube all the way through us.
Yeah, it's a hollow tube going throughout the whole body. So anytime there's an opening of the body to the environment, there's probably going to be microbes there. And that's also where our immune system will interface with that opening. And gut microbiome, which is now everywhere and will continue to be everywhere because we're starting to appreciate for the first time in modern science, medicine, that these microbes have been with us for our entire evolutionary path almost.
Yeah, billions of years before us too, and they've just helped us along.
Yeah, and they're part of us, all right? So they're along for the journey. And what we want as human beings is we want to have the healthiest microbiome possible.
So the way I've kind of learned to think about it is like a forest. Like you want to grow a forest of healthy trees,
yes,
and not all the scraggly ones that are choking out the good healthy ones.
Yes. And you want diversity in the right forms.
Right. So in gynecology, when we think about this, we talk about lactobacillus and probiotics and all of that, but that's not the only bacteria that's considered a healthy part of the gut microbiome.
Yeah, you've got a lot of different types of bacteria that are critical to the microbiome. And we know so little right now,
right,
Dr. Crockett. I mean, we really do.
We're just barely
We're
scratching.
just now scratching the surface. The microbiome is incredibly difficult to study because that's pretty much an anaerobic
meaning without
environment.
air, yeah.
And when you try to study it and pull, things out, so it's very difficult.
You expose them to air and you kill all the anaerobes.
And it just happens like that.
Oh gosh, I hadn't even thought about that.
So it's incredibly difficult to study,
right?
But we're getting better. We're starting to gain insights, and there are some pretty steadfast rules that we have now on what is good lifestyle as far as the microbiome is concerned.
Okay. So this is really important for me and my patients because, you said we're just scratching the surface. All of a sudden, we're understanding that what's happening in our intestines is related to all kinds of things in our body.
Yeah.
Our serotonin levels, our immune systems, never mind how our stomachs feel. But in gynecology in particular, it's becoming important for estrogen dominant conditions that we've seen a rise in over the last decade, like, my favorite, endometriosis. How could I blank on that word? That's my life, endometriosis and fibroids. Endometriosis and fibroids are the two newer ones.
Yes.
We've known that estrogen dominant conditions like obesity and hormones that are just imbalanced can influence cancers like breast cancer and uterine cancer. But we've been questioning now for quite a while within the field of gynecology about why we're seeing such a rise, particularly in endometriosis and fibroids. And so the gut microbiome looks like it's kind of a key to that. And so not only is it important for our immune health, our weight management, our brain function and how we feel, but it's also keeping us healthy from getting diseases that we don't want or things growing in our bodies that people have to come to me to fix. That's not much fun.
Yeah, it's well said. And there's so much more research underway, but you're absolutely correct. Women going through menopause have changes in their microbiome.
Yeah.
Yeah. And so there's a big shift there. I think one of the most fascinating things is the gut-brain axis and how important it is for good brain health to have a healthy microbiome. Yeah. And then if we look at all the metabolic diseases that we have going on out there today, metabolic syndrome, type 2 diabetes, prediabetes, all of those conditions are definitely being exacerbated by an unhealthy microbiome.
Well, and one thing that I learned recently is that a good bit of our hormonal balance happens through the gut wall. So which brings me to the question about leaky gut. I've heard that thrown around so much, and you laughed when we mentioned it downstairs, but patients want to know, what is leaky gut? Does that mean that things are actually leaking out? And why is it important? And what does that have to do with the microbiome?
Yeah. So patients started showing up my practice with leaky gut over a decade ago. And I was like, who's making the diagnosis of leaky gut? And I just kind of pooed it. I didn't what the heck is that, right?
Yeah, it's never been in my textbook before.
And the problem is for doctors, most doctors don't have training in the health of the microbiome yet. But that is coming quickly as we continue to evolve in our understanding of the microbiome. But leaky gut is a loose term that is thrown around a lot. And I think the best way to approach that question is just to look and kind of have a feel for what's happening in the small intestine, for example. And if you look at the intestine, you have these cells lined together, shoulder to shoulder. They're called enterocytes. And
they're held together by collagen.
They're held together.
Another episode.
Yeah, and they're interfacing with a basal membrane, lamina propria.
I love that, lamina propria.
Yeah, isn't that a great word? Good medical term to impress your friends with. Tell them how healthy your lamina propria is. And then on the surface of that is a thin mucus layer. Okay, a mucin layer.
It's kind of slime.
It's slimy.
Mm-hmm.
And you want slime. So when we look at leaky gut, what is that? There's a breakdown or loss of that integrity of the mucin layer, perhaps inflammation with the enterocytes and the lamina propria with inflammation down there. Because you have a lot of immune cells, mast cells, macrophages, so forth in that lamina propria. And so if you have imbalance in your microbiome, in other words, inflammatory bacteria that are, say, not in the desirable, shall we say, ratio, then those bugs are highly inflammatory. And
so that increases inflammation in the body, as well as then the gut doesn't keep things in that are supposed to be kept in. And is that where the term leaky gut comes from?
Yeah, kind of. It's like they're bullies. These guys are big bad bullies, and they bully out the good bacteria.
Oh, that's interesting.
And so now you end up with these bacteria that are, now often these are gram-negative bacteria. Some can be gram-positive, but they're producing something called LPS, and that is an inflammatory protein. And it's just, it gets to be very difficult for the enterocytes to function normally.
Okay.
And so now you've got a breakdown in the cell membranes and how things are with the cells themselves, because if you look at these cells, like I said, they're shoulder to shoulder.
Right.
And there are some things that will cause that border between them to open up. Now there's a leak there, right?
Okay.
And so that's a problem. And when there's inflammation, there's usually a breakdown there.
So is this where conditions like irritable bowel or constipation, those kinds of things come from?
Yeah, I think we don't. When I went through training, everybody who had this label of IBS, they were anxious and hysterical, and it was all psychosomatic. And there may be a little truth to that because stress does play a role in the health of our microbiome. But what we're now understanding is that about 2/3 of the people that have this label of irritable bowel syndrome actually have small intestinal bacterial overgrowth.
Of the bad kind.
Yeah, of the good kind.
Of the good kind.
Yeah, like bifidobacterium and so forth.
Really?
And so there can be overgrowth of the bad. Because of that, there can be overgrowth of the bad kind too.
Okay.
So and there's usually an overgrowth of bacteria that normally we would associate with being healthy for the microbiome.
Yeah.
And, oftentimes this is not always true, but it's kind of a little rule of thumb that can kind of set a little clue off in your head, is if you take fiber and your IBS gets worse, there's a good chance you have small intestinal bacterial overgrowth, or SIBO for short.
SIBO.
Even a probiotic. If you take a probiotic and it gets worse. Okay, well, why did that happen, right? Okay,
so this is a good spot to just break for a second and talk about the difference. Well, like, what is a probiotic? What is a prebiotic?
Yeah.
What feeds good bacteria? What feeds bad bacteria? Because I think then if people understand that, then they can understand what we're talking about when we talk about overgrowth of good bacteria, right?
Yeah, we could use that also as that question's an excellent question as a segue into what has become the standard approach to dealing with people who've got trouble with the microbiome. You can find a lot of this on the Institute for Functional Medicine. They do a great job for clinicians that might be listening. Taking some courses from IFM can be very helpful.
Great.
And they do a lot of great education on that website. But they have a protocol which has now become universal, and it's the 5R protocol. And the first is to remove. Okay, so what does that mean? Well, if there's pathogens in the GI tract, we want to get them out of there.
Like parasites, yeast.
Yeah. You can have a parasitic infection and not even know it. I've had patients who've had parasitic infections for years and they've just been miserable, and you test their stool and boom, there it is, or a lot of yeast. And if you don't take care of these bad pathogens, then you know what? There's just nothing's getting better, because these are big bad bullies.
Okay, so the first R is remove. What's the second one?
Well, we're not just removing the pathogens, but we're also going to remove medications, if possible, that are exacerbating the problem. And so
antibiotics?
You know, antibiotics are like a nuclear warhead going off in the microbiome.
I've heard that.
And that's why physicians are becoming more and more sensitive about trying not to overprescribe. I think a lot of patients will call their physician. They feel crummy. You want to feel better. The doctor wants you to feel better. And the doctor caves and prescribes an antibiotic. 95% of the time, this will be a virus or an allergy.
That don't respond to antibiotics at all. So you just detonated a bomb in your microbiome.
Yes.
And didn't fix your upper respiratory thing.
And now you've knocked out a lot of the good bugs. And now the bad bugs can now come in there and take over.
Okay, so what other medicines other than antibiotics are we trying to remove? Probably
one of the most popular and widely used ones is proton pump inhibitors. These are going to be the popular trade names of Nexium, Prilosec, omeprazole, these sort of acid-suppressing medications that are used to treat reflux disease, GERD, gastroesophageal reflux disease. And what happens with that is now the pH of the stomach has now changed chronically if you're on these long term.
Yep.
And it's not that these medicines don't have a place. They do. But long-term therapy is something that can be a problem. And, you know, we try to get patients to, you know, eat healthier, lose weight, you know, avoid those aggravating foods. And we talked about removing pathogens. Well, H. pylori, Helicobacter pylori, 20% of the population is colonized with this. And for most people, there's different strains out there. There's some strains that are just kind of garden variety, not problematic, H. pylori. And then there's others that really do have virulence factors that can really wreak havoc with the stomach and everything from causing reflux to causing peptic ulcer disease, ulcers, to even gastric cancer.
Wow.
And, you know, the reflux long-term untreated can contribute to esophageal cancer.
Yeah.
These are very serious illnesses. So the last 30 years, we've been suppressing acid with these medicines, and they work. But the problem is now the pH is no longer acidic. The pH of our stomachs is normally 2.
It is really like acetic acid.
Hydrochloric acid is 1. That's like one of the strongest acids out there. And there's a reason for that, is because we evolved eating just dirty food.
And so it kills stuff as it comes in.
Yeah, the stomach's got to kill off these bad bugs.
Right.
So now that's gone, and that can cause troubles downstream. Other bacteria that are not so desirable, like staph and strep and many others, can begin to proliferate inside the GI tract. And now we've got trouble. Now we've got diarrhea, we've got cramping, we've got bloating, we've got all the things that go along with that.
Yeah. No good. Okay. So the first R is remove, and we're removing pathogens and medications.
And we're going to do 2 more removals real quick. Okay. We're going to remove what is really the culprit, and that is the bad food. And
that's the hard one.
And this is...
No, they don't want to hear that. Y'all don't listen to it. No, I'm just kidding.
They don't call me Dr. Killjoy for nothing. So
remove the bad food.
But actually get the bad stuff out. You stop craving it. Now, the average American is consuming 250 plus grams of processed carbs and sugar per day.
Refined sugar, refined flour, processed carbs.
Yeah.
So the difference between a processed carb and an unprocessed carb is like your vegetable or your fruit that you eat.
Very good point. The carbs that you find in whole plant-based foods are the healthy stuff. Okay. Right. Processed carbs, breads, chips, crackers, tortillas, muffins, you know, all of the baked stuff. I call it frankenfood because it's made in the lab, the kitchen. The whole foods are just in nature. You know, I've never found the bread bush or the tortilla tree. I'm still looking. But we love those things because we grew up eating them and they're convenient to use, but they are very addictive and cause metabolic syndrome, weight gain, and everything else. But the problem is the sugar and processed carbs are causing the imbalance in the bacteria And so we need to quit,
feeding the bad bacteria, right?
A great way to think about our microbiome is it is what we feed it.
Yep.
Just like we are what we feed it, right? That old saying, you are what you eat, so is our microbiome.
Yep. Wait, did you see that new Netflix special? Have you seen it?
I haven't seen it.
It's great. I think this is the second episode that I've referenced it. It's called You Are What You Eat.
Yeah.
And it's a twin study. They did identical twins.
Yes.
And it's a 4-part series. It's great. So y'all need to go check that out. And the vegan or vegetarian, I think it's vegan, and then a healthy omnivore diet. They didn't give them crap omnivore stuff. They did a pretty good job of balancing it nutritionally. And it was just, it's startling. I'm not going to give it away. Y'all go watch it. It's pretty good.
I have heard about it, haven't seen it.
Yeah.
But there's that old saying in medicine, and that is your genes are the gun and your lifestyle pulls the trigger.
Well,
yeah.
Oof, that's big.
Yeah. So what we want to do is quit self-destructing here, right?
Okay.
So if we're consuming 250 plus grams of processed carbs and sugar per day, how much should we be consuming? Under 25.
Yep, that's what you always teach is under 25 grams.
Yep.
And you know what? If you want to find out how much you're doing, go get an app. Go download an app like
MyFitnessPal is a great app.
You can just log into there and you'll see real quick those refined sugars versus the non-refined sugars. Yeah. So under 25 a day. The other food that I teach my patients to take that has the number 25 is fiber, that we want at least 25 grams of fiber a day.
Yes.
Yeah.
Yeah, you're absolutely right, Dr. Crockett. 30 grams of fiber per day is what the microbiome wants to eat. Okay?
So does it matter if it's soluble or insoluble?
You want a balance of both, but I would just say fiber. Look, right now,
just
for my patients, get the fiber in.
Okay.
Because the good bugs are going to be feeding off that, metabolizing off of that, and making something called butyrate, which is a key source of fuel. It's a short chain fatty acid. As a matter of fact, the epithelial cells, the cells that line the colon, that's all they use is butyrate. And if you're not getting yourself enough fiber, your colon's not functioning properly. It's not possible.
That makes so much sense.
Yeah, absolutely.
Okay, so we digressed a little bit, but that's kind of what we were going to do today. So it's my job to get us back on track. So we're talking about the 5 R's. 5 R's of...
And we want to remove pathogens. We want to remove medications. And trust me, I didn't even touch... I'm just scratching the surface when it comes to medications. Alcohol is something that just wreaks havoc.
Kills it.
NSAIDs, non-steroidal anti-inflammatory drugs, your ibuprofen, those sort of things. Aspirin wreaks havoc with the mucosal lining and can cause leaky gut.
Okay.
So, we want to remove these things. And then stress. Okay. So, we all have stress.
Maybe we'll talk about that later.
So we will.
We'll get to that.
Because stress kills, right?
Right. And this is part of how I never thought of it as killing my gut.
Yeah, it does. It's really a problem. And it decreases immune function. Now, once again, you're going to have microbiome wherever the body is interacting with the outside world. And a big part of that is immunoglobulin A. And IgA, you can find it in your saliva, your lacrimal glands, your tears, right? You can find it in your GI tract.
Breast milk.
And breast milk, yeah. And it's there and for a reason. Mm-hmm. Now, if you're stressed, your IgA levels could be low. Yeah.
Okay, so we're removing all that stuff.
Okay, that does it for removing.
Okay. These are the 5 R's of what?
Institute of Functional Medicine.
The 5 R's of healing a leaky gut.
And this is really healing, getting a microbiome back into balance.
Okay, so we're removing all the stuff we just talked about. What's the second R?
Yeah, the second R is going to be you want to replace. So if somebody has, say, pancreatic insufficiency, the pancreas just isn't quite getting it done. The pancreas makes digestive enzymes that are very important.
Okay.
And if you have low functioning of the pancreas, then that can be a real problem. You can get a stool elastase level done, or some will look at fat in the stool. If you have a low elastase level, that's an enzyme made by the pancreas. And so that's kind of a hint there. The pancreas isn't working as well. If you have a lot of fat in your stool, that could be a sign that the pancreas isn't making enough lipase and we're not digesting fat as well, or it could be something wrong with the gallbladder and bile production.
How does having your gallbladder out affect?
Well, it can affect things. Yeah. I mean, our microbiome likes bile. to a point. If we get too much fat, we talked about processed carbs and sugar. If you get too much fat, then you get excessive bile, and that can cause trouble with the barrier, the mucin layer, and so forth.
Okay, so we're on the R for replace.
Yeah, so we're replacing, if a person has some pancreatic insufficiency, you can replace enzymes orally, which is really simple to do. Or if somebody has hypochlorhydria, this would be low acid production from the stomach. You can have them take orally a product called betaine, Betaine, and that helps with digestion of food. And then there's other things that can be done to help the GI tract digest and handle food properly. If that doesn't happen properly, once again, bad bugs can start to set up shop and proliferate off of undigested food.
So what I didn't hear you say in replace was probiotics, which are replacing the bacteria.
Yeah. So when we talk about these 5 R's, that comes later under reinoculate.
Okay,
that's
reinoculate.
A great question.
Okay.
Yeah.
And that's also where stool transplants are going to go.
Yeah, stool transplants, you could look at them that way. Yeah. That's exactly what happens with stool transplants. Yeah, it's incredible.
Sounds gross, but I think it's just fascinating.
Yeah, it's fascinating. And, for our listeners, they're wondering, well, where are you getting all this information about your microbiome? Unfortunately, most MDs today are not trained in this stuff.
No, I think that's why this is so fun. It's so interesting.
And the field is evolving. But if you can find an MD or someone else who's got proper training, these are specialty tests that practitioner can order. They ship you a kit. You give them a sample. You sip it back, and then the doctor gets the report and then is able to sit down and go over that with you.
So there's only 2 sources I know of this right now. One is you. Right.
There's a lot. Listen, there's a lot of folks out there, but how do we connect the public?
Yeah. And the other one is that company Zoe that's doing all the research on the microbiome. You can send in your testing through them too. Have you worked with them at all?
No, I haven't worked with them. I've worked with Rupa Labs, RUPA.
Okay.
They do a great job. And then, any physician, you might go to the Institutes of Functional Medicine and look for doctors and see and look for a doctor there.
So we can put links down in the show notes below, but I think that would be really helpful for people too, because, don't come to me. You can come to me for your endometriosis. Don't come to me to get your gut microbiome fixed.
I will tell you, I was reluctant. I was skeptical.
Yeah.
But the more I looked at as the data just kept piling up.
Yep.
And then colleagues that I have deep respect for, our former chief resident of my class,
really
super brilliant guy, Jeff Horacek. He has helped me. He's kind of mentored me over the years and helped me to understand it better. And the more you dive into this stuff, the more you go, it just clicks.
It's like the puzzle piece that's been missing, and now you're like, oh.
Yep. And now you look at the patient differently.
Yeah.
You're like, oh, okay, no wonder you're miserable. When you get those test results back, it's for some people, there's a war zone.
Well, I tell you where it's a war zone for me is I do a ton of pelvic prolapse surgery. A lot of pelvic prolapse. So I'm going to diverge our conversation for just a second. I'm going to hijack it, not just divert it. So pelvic prolapse is when the pelvic organs start to fall down. And well, I'm a gynecologist, so I'm not going to talk about men at all. But in women, I get women who come in all the time who think that doing Kegels or strengthening their pelvic floor is going to keep them from having pelvic prolapse. And I always explain to them that no, the pelvic floor is in this plane and things are falling down in this plane. So you can squeeze all you want. It's really good health benefits of keeping a healthy pelvic floor. It's skeletal muscle, just like the rest of the muscles. But if you want to do something about the prolapse, you have to do something about the stress that you're putting on the organs, which comes from increased intra-abdominal pressure. And often, not always, but often that thing that's going on that's causing that pressure is chronic constipation and straining. And it is maddening to deal with because, I can deal with a woman who has pelvic prolapse because they had some trauma from childbirth, or their collagen is getting weaker because they're growing older. I can behaviorally manage people that have jobs or they're doing heavy lifting, or my ranchers that are throwing hay bales around. I'm like, you just can't do that anymore. Sorry. But by the way, they're also some of my healthiest patients. But the thing that is the booger to me is the chronic constipation, because I can fix them all day long and they will just keep failing. They'll keep failing if they don't address that. And I struggle. Like I send them to gastroenterologists and they get kind of the standard colonoscopy and meds for diarrhea or constipation or IBS, and none of it is addressing what you and I are talking about. And so I've newly become interested in this just because of that issue. And I'm just floored by how much we don't understand about it. Like I can't just put everybody on probiotic fiber. Like just eat your vegetables, go watch my show, take your fiber and your,
Believe it or not, Sue, that will help a lot of folks.
All right.
Right
well,
there.
Thanks.
That will help a ton of people. But if you look at these test results, when you get them back, there is a class of bacteria that are methane producers.
Okay.
And if they're high, then those folks are more prone to constipation.
Okay.
All right. So, it's science, right? Once again, we're in science, we want to first measure.
Yeah.
So you're going to get your blood drawn, X-ray, CT scan, whatever. Here, it's a stool sample. And these tests are using a polymerase chain reaction PCR technology, which means
DNA.
if there's a scrap of DNA, boom, it's going to, and they can quantify that. And so each of these bacteria or pathogens are being quantified in these reports. So it's a big leap forward for us. We still have a long way to go, a lot to understand. But when you talk about, what are you trying to replace? Well, you want to help the GI tract out first. And so you say, okay, well, what next? Well, you want to reinoculate.
Okay.
So getting to your probiotics.
Okay.
So, and there are a lot of probiotics out there, and it is the Wild West. And most of these have lactobacillus, bifidobacterium, and so forth. And those are good bacteria that we want to have. So they can be helpful. Probably the one that's getting the most attention right now is something called Akkermansia, mucinophilia. We'll just call it Akkermansia.
Okay.
And it falls into the category what we'll call a keystone bacteria. In other words, this is a really important one. And I think what probably brought most of the attention to it recently is a company called Pendulum. And they actually did a study, to their credit. Now, this was a very small sample size, but they took type 2 diabetics. These weren't people with raging type 2 diabetes. They had like A1C 7.5, 8.5-ish range. And they gave them a combination of 5 strains in Akkermansia. And I believe it was a 3-month study. And after 3 months, their A1Cs had dropped 0.6. Now, that is a bunch. And if you look at also the spikes, because when you have type 2 diabetes, you're more prone to get blood sugar spikes. Those spikes were brought down 30%.
Just by reinoculating them.
And by doing that. The problem with that has been cost. And so they're trying to figure, because Akkermansia is very difficult to grow. Okay. And so they got to get it just right. They even ship it to you in a chilled container. You have to keep it refrigerated. I mean, this bacteria has to be treated properly. But I will give Pendulum a ton of credit. They have used real science to try to say, hey, cause and effect here. Now, do we want to see more? The scientist in me wants to see more. Yes. And there's a lot more studies underway right now. There's at least a dozen studies underway worldwide, just looking at the impact of Akkermansia and a whole host of different conditions. And we're going to probably hear a lot more about it. So Akkermansia is a keystone bacteria. And so that, you can get that product. I use that for my patients who are low, because that's one of the key bacteria that we measure for with a stool test. And then if there's other imbalances, we'll reinoculate them with another type of probiotic as well. But we also want...
And sorry to interrupt, but just inoculations, people always think of shots vaccinations.
No, these are just capsules.
These are just capsules that people eat.
Yeah, that's a good point. No, we're not going to shoot them up. No. We're not going to go, probe you. We're not...
Don't have to even have an IV fluid kind of thing.
Yeah, these are just capsules. Yeah, very easy to take, very well tolerated. So that, the reinoculation stuff is very beneficial. And then we want to replenish. This is the 4th R.
I hope you're enjoying this conversation with my very good friend, Dr. Reed Miloy. We had such a great conversation about this microbiome health issue that it actually extended into a very long interview. And so we've decided to break it into 2 parts. So thank you for listening to part 1. If you enjoyed that, please like and share with your friends. Share it with people who need to know about this. And we have more coming. So check out part 2. Thanks for listening to this episode of Becoming Virtuosa. To learn more, come visit us at drcrockett.com. That's drcrockett with 2 T's.com. Or find us on YouTube for The Dr. Crockett Show. If you found this episode helpful or think it might help someone else, please like, subscribe, and share. This is how we grow together. Thanks, and I'll see you next week. Love always, Sue.